Okay, so this is the retinal pigment epithelium here. This white line at the bottom, the retinal pigment epithelium and Bruch's membrane complex. So these are abnormal. If we observe, we have some homogeneous reflections under that point of elevation of the retinal pigment epithelium and Bruch's membrane complex. That tells us that this is not just Drusen, but also a Drusenoid PED, a Drusenoid pigment epithelial detachment. If we look closely, the difference is that this is a PED, because if we look closely, there's also some basal laminar drusen here, meaning it's underneath the photoreceptors or not underneath the RPE Bruch's membrane complex. Take a close look at this one here. It's right on top of, or just on top of the RPE. It seems to just in between the RPE Bruch's membrane complex, even though it does distort the ellipsoid layer here. The ellipsoid layer is this. There are two lines here. This one at the bottom is the ellipsoid layer, and this one on top here is external limiting membrane. So the ellipsoid layer is the area of demarcation between the inner and outer segment of photoreceptors. Is very important for prognosis and good vision. So we can see there's a marked elevation of the ellipsoid layer here, just adjacent to the fovea here. So that's a concern for the patient's visual recovery. So in this case, with this amount of subfoveal drusen, 1, 2, 3, 4, and 2 of which are PEDs, the patient needs very close monitoring. There's a high risk for macular neovascularization in this case, and this patient is also at risk of progressing to geographic atrophy, which indicates advanced AMD much more quickly. So here's the 3D image. You can see all the large drusen everywhere, and of course, not surprisingly, she has history of hyperlipidemia from a serum cholesterol test at the labs.